Hello, my name is Jenny Olson. I am an RN in the Minneapolis-St. Paul area. I'm taking a course at National American University this quarter, and this is my health assessment. For my health assessment, I have chosen to focus on RSV, or Respiratory syncytial virus. RSV is a very common cold virus that spreads among daycares and crowded populations. RSV oftentimes attacks children that are under 2 years of age, but it can occur in any age. It is so widespread and common because the virus can live for so long. It can live up to 30 minutes on your hands, up to 5 hours on a door handle or countertop, and many hours on a tissue, a Kleenex tissue. You can catch RSV if an infected person coughs or sneezes on you. You touch, kiss, shake somebody's hand, rub your eyes before washing them. It can be transmitted without someone even knowing. This is why in daycare centers, notes are oftentimes sent to parents letting them know that there has been a case confirmed in the class. It's really important to educate the patient on proper hand washing skills, washing with friction for a minimum of 30 seconds, and just educating them on how the virus is spread in order to maintain control. People can be at an increased risk for RSV if they are attending a daycare, if they were born preterm, or if they were part of multiples that were born. Being near tobacco smoke puts you at an increased risk. Having a school-age sibling in the home, or living in crowded conditions. A lot of times, many cultures live with multiple generations in a household. These people would be at a higher risk for contracting the virus as well. Symptoms vary and often differ with age. The newborn baby may present with different symptoms than the 18-month-old child who's weighing 90 percentile of their growth chart. You want to look for signs and symptoms of blueness, any blueness or cyanotic changes around the lips, the nose, the digits, the extremities. Watch for difficulties breathing or labored breathing. The patient may have a cough depending on the severity of the illness. At first diagnosis, RSV, you may hear some wheezing or some coughing, but as the virus progresses, you may not hear that because the bronchioles are so constricted that it does not promote good airflow. And when there's not good airflow, you're not going to hear the wheeze that you would in a less infected person. You will also notice a fever, maybe some nasal flaring. The child may have to really work at breathing, so they may tripod a bit to get more comfortable. Oftentimes they lose their appetite just because it is difficult for them to breathe when they eat. So of course they are scared to eat because they can't breathe. They also may have a stuffy nose. There are the tests performed for RSV is a nasopharyngeal swab. You want to make sure when you're swabbing the patient that you go in at an angle. So if you have their head tilted at about 45 degrees, you go right in near the nasal septum. You go until you meet a little bit of resistance. Now, in order to do this without harming the child, you want to make sure that you have a good firm hold of the head. Oftentimes it may involve another coworker holding the baby so that you can get that accurate swab. Because RSV is a virus, there isn't an antibiotic that can treat it. You can treat the symptoms, but you can't treat the actual virus. A lot of times parents will come into the clinic wanting medication for this, and they leave feeling very dissatisfied because there is not an antibiotic that can treat this. We can, however, treat the cough, which may cause pneumonia. antibiotics would be successful for that. A lot of times oxygen, humidified air, nebulizer treatments are used in the treatment of the symptoms. In bad cases, the child would be hospitalized, and in the even worse cases, they may have to be on a ventilator. It can cause death in infants, but it's very unlikely, especially if the parent seeks treatment early on. In young children, RSV can cause bronchitis, croup, ear infections, lung failure, pneumonia, and children who have had RSV are more susceptible to having adverse reactions from asthma. There is a drug that can be administered in newborn children or in children under the age of 2 years old. It is called Synagis, and I have a link for this on my webpage. Synagis is administered to children who are born during the months of November to April, especially if they're preterm or multiples. They will oftentimes administer the Synagis one time a month during the RSV season to help prevent it. In the nursing assessment, you want to ask for the patient's full health history. Any symptoms that brought them in today, what is their chief complaint? Is it the cough? Is it the runny nose? Is it labored breathing? You just want to make sure that you have the whole health history. You want to know the onset, when they first started noticing the runny nose or the cough. You also want to ask, are they preemies? Are they part of a multiple? Do they have exposure to secondhand smoke? The physical exam includes the inspection, observation, and auscultation. Inspection is just looking at baby, getting a good look. You would want to remove any clothing from the torso area and also the legs, just to make sure you're watching all the muscles and how they are, if they are retracting or if the patient is using any accessory muscles in breathing. Also look for signs of cyanosis, which this again is the blueness around the mouth area or the nose or the fingertips or toes. Their general appearance can oftentimes tell you a lot. You can really tell if they are making an effort to breathe or if it's just a cough or a wheeze. Generally, cyanosis is noted in later signs of RSV. That's showing that the virus has progressed. Now, when listening to the lungs of the patient, I will take Buddy Bear. You want to make sure that there's not any clothing in the way, so that there's no barrier between the stethoscope and the chest. And then you go from right to left, listening for approximately 8 to 10 seconds on each side. And you can go to the lower lobes as well, listening, again comparing sides. There. And you want to make sure that while you are listening, oftentimes in children's it is more difficult. Sometimes they start crying when you start to listen, so it's really kind of hard to hear those sounds. But in infants and children, it does become quite loud, especially if there is that wheezing going on. Once you have listened to both sides on the front, you can then listen on their back. This also is, we go bilateral so that we can compare sides to one another. So again, listening for about 8 to 10 seconds on each side. We go on the top, other side. We go on the middle lobe,